Hey everyone, welcome to Inspired Stretch with Dr. Gold. Just a little quick information. Yeah, there you are. I wanted to just mention some over-the-counter medicines that a lot of my patients have used pretty often, like Motrin or Aleve for a headache or neck pain, not realizing that if it's over the counter, it can still have side effects. So we need to be careful. So there's actually reported 16,000 deaths just with these NSAIDs, Motrin, aspirin, because of bleeding related disorders. So be mindful. The nice part is there's a healthy alternative. And instead, I recommend turmeric or magnesium, but turmeric is a natural anti-inflammatory. In studies, it actually has shown to be as beneficial as ibuprofen for arthritis of the knee. And if you have a lot of tendonitis, it can help with that too, without destroying the gut. The way the Motrin or Aleve or this category of medicines work, they're called non-steroidal anti-inflammatories. They stop prostaglandin. That helps pain or stops pain. The concern with it, it also, prostaglandin supports the mucosal lining of the guts. So when you actually stop that or inhibit it, it can actually increase your risk for a bleed or an ulcer or reflux. That's why sometimes they say to take it with food. But some people have been taking it for a long period of time. I've had patients say, oh, I don't take it that often, but they're doing it a few times a year. So it's good to ask, how many pills have you taken in your lifetime? If you're like, I have no idea, probably too many, more than 100, most likely if you've been doing it for many years. So people just pop it. It's like cheap and it works, but the concern long term is the gut aspects. It can raise risks or raise your blood pressure, risks for heart disease with some of these medications. So just be mindful. Kidney disease is another problem. But we're going to get started. I just want to at least mention that turmeric, another viable option, a great anti-inflammatory. It's also known as curcumin, which is the active ingredients in turmeric. Okay, so we are going to do heart openers today. I am using my husband's tie. If you don't have a tie, you can use a towel for this, but we're going to actually rotate and open the shoulders. If you don't have anything to do, or a tie or a towel, no worries. You can always just stretch out those arms and pretend, and that's okay. So we are going to have some fun in the sun. So if you do have the strap just about shoulder width apart, we're going to just lift up, lift. And as you can see, my hat is a little tall today, so I will probably take it off in a moment, but I'll leave it on for now. It's actually allowing me to stretch out my arms. And remember, we're doing the Halloween costume get up, so stay tuned. If you are a Harry Potter fan for tomorrow, you can wear your robe or any get up that you have for that. So feel free to wear some funny hats or wigs or just, have some fun with it. If you're in your pajamas, that's cool. Just gently rotating back and forth. Now again, if this is way too much, if you're working or nursing some shoulder injuries, you may not want to bring those arms all the way up overhead. Another option you can do is bring the hands a little bit closer and just come halfway. You don't have to go all the way up. I'd actually recommend, if you are nursing shoulder injuries, don't bring your arms all the way overhead. That can aggravate it, and we don't want to do that. No shoulder problems, arms go all the way up, back behind you, and then forward. Good, one more time. Inhale. And then just reach. Open up the shoulders. Again, if this is too much, arms are just halfway, and you can just bring the strap in front or just allow those arms to open this way. Good, one more time. Oh, my hat's falling off. There we go. Good, and we're going to just reach all the way over to one side. All the way over to the other side. Oh, it feels so good. Reach back. Good, and let me take off this hat. So good. So what we're going to do now is get some hip action going. I want you to rotate those hips, rotate them around here. Hold on to your strap. We're going to use it in just a moment. Again, if you don't have the strap, we just pretend. Good. So we're actually going to stretch those triceps. You're going to just bend. You may be able to reach the other hand, so the other hand is going to go around you, behind you, and if you can't reach, my hands are not touching, I'm using my strap. So I'll show you from the back. You can hold onto the strap. The other option is holding onto your clothing. So if you're wearing a shirt or something, just hold onto the shirt. That's another option. Reach those elbows away from one another. Reach away, and then reach over to one side. Gaze up, smile. Reach over to the other side. Reach back. Good. So heart opener is really important to allow our heart to come forward. Some people say, well, I don't want to expose my heart. It's a means of vulnerability. I don't want to ever fall in love because I've been hurt so much. But remember that benefit of being with somebody, of opening your heart, of how much love can pour forth. And I think the benefits far outweigh those risks. So really important to enjoy life and give so you can receive. And remember, if you don't have openness of that heart, we're not going to be able to receive it too. And if your cup is empty, you're exhausted, you're not going to be able to help other people, and also namely yourself. That's important too. So we got to help ourselves. Number one here, and I believe in you. You can do this. So if you're sickly or just not feeling good, you're just tired all the time, you see your doctor and all the labs are normal and you're like, what is going on? Please, I highly recommend check out or seek out integrative or holistic doctors so they can at least delve deeper. Check your hormones, check your toxicity panels, check for mold. I mean, the list goes on. Check your gut, but make sure we're not missing something serious, because there are preventive things you can do before you get that cancer, God forbid, or COVID, or a disease or illness or an inflammatory condition or diabetes. So let's work. Now, if you have these conditions, there are ways. We know type 2 is a lifestyle condition. You can do something to help you to reverse that. So nice part is what we eat matters. Let's reach the elbows and keeping it simple, because it can be confusing out there. It's like, what do I eat? Do I eat fats? Are they good for me? And it's good. I always say, let's use a common sense approach. What are most of our cells made out of? So we're reaching those elbows back. Remember, holding on to strap or your shirt, or just if you can, your hands can reach, go ahead and interlace those fingers. But our bodies are mostly made of, and all the cells are fat. Fat cells line all our cells. So if that's the case, can fat really be bad? And all our hormones are made from cholesterol, which is a fat. So actually, good fats are really good. There are essential fatty acids, EPA and DHA, we need to have so we can have good brain function. So I'm actually really happy. My dad's from the Caribbean. He got us started on fish oil. And I didn't really like the form. It was raw cod liver oil. Nowadays they have so many better flavors, like Barlean's is a nice one. They have it in a swirl, or you can get it in capsules. I recommend freezing them so you don't get the burpees. But he gave it to us raw. Yeah, we did it because, he's our dad and he told us we had to. But we never really got sick. I remember running in New York City in Central Park in the winter and we were fine. Okay, gaze up. Okay, we're going to reach all the way over. Good, big smile again. Gaze up and reach all the way over to the other side. Reach back. Good. And shake the body. Shake your body. Have a big smile on your face. You can do it. Okay, so the thing with the strap right now, we are going to hold it in front. Now, if this bothers the wrist, you can actually just wrap it around those wrists and then put it in between the thumb and index finger. So this way you're not gripping anything. We did some exercises with the hands before. We know if you hold a mouse all day or your phone, which I don't recommend, the hand can get gripped. So make sure you're getting some ergonomic equipment that'll help. And if you need to do it this way on both sides, if you can see, my hands are flat here. So really what I want to start working on is opening up the body, opening up the palms. So just kind of pull. Good. And again, if you don't have the strap, just pretend we're just resisting. So pretend your hand is maybe in some molasses and we're just pulling against it. Or if it's in some water, we're pushing against that resistance. There we go. You can do it. Good. Release. Now shake. Good. Now, and then we're going to just massage out those hands a little bit. So just gently reach those fingers and just gently rock. Be kind to your wrists. If you've had surgery or anything serious, of course, don't press all the way. Just gently release them down. And if they're tender, achy, sore, it's okay to shake them out a little bit. Give them a little massage. Give them a kiss. Good. Interlace those fingers and just kind of see if you can lengthen down here and then rock. Good. Open up that thumb. Oh, that feels so good. This is my special side. Again, I've been moving my mouse to my other hand because I've been using my right hand more, and I just didn't want to overdo it. So I'm not calling it my mouse hand anymore. I'm going to be balanced. I got to practice, right? And then reach up, reach up. Good. Just gently down, side to side. Then we're going to take the thumb of the other hand, just rotate, and the fingers are wrapping around the front part of the wrist, and we just turn. So feel that pinky turning towards you, wiggle those fingers. Good, there we go. And just kind of gently moving that wrist back and forth. Little circles, and rotate a little bit more. Oh, shake, shake, shake. Rotate that hand, open and close it. Okay, let's go to the other side. Again, be kind to that wrist. Send it some love. It needs it, yeah. Little massage of that palm. Good, and the center part, especially that area right below the thumb, that can get worked quite a bit because we use our thumb a lot. So I've actually been trying to use my other fingers when I'm texting. Can you imagine opening or turning on your phone with your pinky finger? Have you ever done that? It's hard, but I've done it. Working to strengthen up the other fingers too. Okay, and then just gently back. So bring that thumb back. Oh, don't force it. And then the fingers. Oh, good. And then rotate that wrist. Good. Wiggle those fingers. Wiggle, 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 wiggle. Good. Shake, 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 and open and close that. Those hands. Let's play the piano. Upside down. Okay, so we are actually going to come down to the floor. I'm going to show you some hip openers with a strap. Again, if you don't have it, you can use your hands to try to open. You can always modify everything. So if things don't feel good down to the floor, you can do this in a chair as well. So we're coming down, coming down, coming down. Oh, so you can either come through on a squat or not, just whatever feels good for your body. And then I'm going to show you what we're going to do. I think this will work here a little bit better, so you can see me a little bit more. There we go. So with your strap, I just want you to place it around the ball of your foot. We're actually going to open. We're going to be doing this lying down, but I want you to see me sitting up first. Now again, if you're in the chair, you obviously won't be lying down. You'll just be doing it sitting. Try not to sink in those hips. I actually want you to lift up the belly off the hips so the spine is nice and long, and you bring that leg out. Okay, so on the floor, I'm just going to be down and bringing my leg out, and then we're going to be switching hands and bringing the leg across. This is a great IT band stretch. It is one of my favorites that I love for opening up the hips. Listen to your body. Do your best. Again, if you don't have a strap, you can just hold on. You may not be able to reach the foot, but you can hold on to the thigh and just open up the leg as wide as you can. Then gently release it. Again, not forcing it, but permitting it to open. So I'm lying down, holding onto the strap. So it's around the ball of my right foot, and then I'm opening. Strap is held in my right hand. And then I'm just gently releasing. My other arm, you can't really see, is extending out. So I'll try to come out a little bit. Oh, it feels so good in the body. Just to open up that hip. Try to keep that leg that's flush with the floor down. Try to keep those toes pointing up. Spread your toes. Turn your head away from the strap. And then switch hands now. Inhale. Take the strap in the other hand and reach it all the way across the body. Feel a nice stretch in the outer hip. You don't have to go all the way down. Just go where you can. If you want to get a little bit deeper stretch in that hip, turn your foot in. So turn those toes down just a little bit more. So 45-degree angle. Bring those toes back towards your knee. And again, feel a nice stretch. Tap out the hip if you need to. My hip can get a little cranky, so I'm telling it to behave, sending it some love. Good. Breathe. Inhale. Bring that knee in. And just kind of circle it around now. Circle it around. Circle it in the other direction. Oh, good. And now with a bent knee, we're just going to open it up. So just bend the knee. If you feel like you want to straighten it out again, that's fine. Otherwise, you can keep it bent. And then we're going to rotate it over again. This time it's bent. Reaching all the way across. Your head is turning away from that bent knee. Good. Inhale. Oh, it feels so good. We're going to go to the other side. So again, you can always start sitting up wrapping around the strap, around the ball of your foot. And again, if you want to do it sitting is one option, where when you reach it across, you just switch hands, like this way, or you can do it lying down. So I'm going to lie back down. It just feels good to rest. You can do this in bed too. It feels lovely. Open up that foot, open it up. Turn your palm open. Good. So my extended arm that's not holding onto the strap, the palm is up. It's straight out, so in its T position. Turning my head towards that open palm. My strap is holding onto my foot and just opening up that inner thigh. And then reach up across and over. Feel a nice stretch in that hip. Oh. And just hold it just for a few seconds. Good. So my head always turns away from the leg that's moving across the body. Good. We're going to bend that knee now. Let's just circle it around. Circle it one direction and then the other. Oh, it feels so good. And then we're just going to gently release that knee. Again, not forcing it, just allowing it down. So if you just want to hold on and press into the inner thigh, and then gently reach the knee across all the way over. Feel a nice stretch in that hip. Oh, it feels so good. Yay. Good. Both knees up. Little circles. This is really good for that back. Stretching out that low back, those hips. Cross at the ankles and just hold on to your feet. If you can't touch, you're holding on to the knees or the thighs and just rock. Good. Little circles here. And the other way. Oh, good. If it's okay to rock, rock to one side. Let's go to happy baby. Hold on to the tops of the feet or your knees or your thighs. Just gently rock side to side. You can do wide-legged happy baby. Yay! And just say wee! Wee! And then we're going to rock up. So rock up, baby. Yay! Very good. Have some fun with it. So we are on the floor. We're on the floor. I just love stretching. Stretching is so good for your body. It's a wonderful way to loosen up. It's a great start of your morning. We're going to reach the ear to the shoulder. Good. Chin down to your chest. Good. Over to the other side. Good. It also helps with sleep. So if you're waking up in the middle of the night or having trouble falling asleep, you can't turn your mind off. These stretches can help you release, let go of tension. Feel free to add a journal with it after. Sometimes people use warm milk. It's for the tryptophans, but I would highly recommend organic, or I go to the Goat Lady unpasteurized milk. This is the one I use. But you want to find something that works for your body, that has the most natural minerals. And sometimes it might be an almond milk, but without so much sugar. You can actually make your own almond milk, which I didn't know was so easy. Okay, you just get the almonds, you soak them, rinse them, and then you can put them in a blender and add just a little bit of water if you want it thick, or maybe a cup of water if you want it a little thinner. It's so good. About just 1 cup, and then you can adjust the water. You just want to cover it when you stick it in the blender. But I usually soak it maybe a few hours. Chin down to your chest, look up again, bottom lip over your top. Remember, we're not jutting our chin, so feel that chin reaching towards the back of the head. Lengthen the back of the neck, lengthen the front of the neck, bottom lip over. And then move your chin side to side and pulse your bottom lip up. Good, big smile. We're gonna actually roll our tongue, so let's have some fun with this. I love to play, so I think play is just my key to my laughter, because I just want to be a kid. You know, we all have our kid inside, and the more you can just be woo and have some fun with it, it gives you a lot more energy too, natural energy. This is also how cannabis works. We're releasing endorphins, so naturally you could do that with the laughter. Woohoo, woohoo. Okay, so we're gonna roll the tongue. How long can you go for? We're gonna purse those lips, so pretend like a little horsey. My neighbor loves horses. My dad used to race them, and they're so cute. So, nice big horse or a little pony. This is actually really good for your vocal cords too, because we're strengthening the mouth. We're actually relaxing. Make sure you're hydrating today really well. Really good to make sure we don't dry out our sinuses. We know the mucosal layer inside the nose is a protective layer for any, protecting us from viruses or bacteria or fungi, right? Fungus. But if that area gets dried out, it can be a nidus of infection for that bacteria or virus to lay. So much better. I use a little moisturizer inside there. Burt's Bee or beeswax can make a huge difference. So let's do this. I'm creating a little saliva here. And again, just roll those shoulders. I'm going to reach that ear to the shoulder here and just gently massage the side of the neck. Oh, it feels so good. And I'm really going right where the hairline is. Good, and the other side. Good, and find spots. If there's any areas of major tension, just feel free to get there. For me, it's literally right underneath the earlobe, right where the jawline meets. Oh my God, that is really tight. But when I massage, it feels so good. So I've seen a chiropractor for my TMJ, that temporomandibular joint where it can kind of get stuck. I used to have a lot of clicking in my jaw when I opened and closed it. And as you can see, it's very, very light now, barely noticeable. Maybe a little bit. I have to go see her. But it's not as bad. It literally would lock up and it would be very painful. And thank God. And I hold tension here as well as in my neck and my hips. So by stretching out on a regular basis, it's really has helped me to have less pain. Also be on less pain medicines, because I used to take ibuprofen and Motrin when I was a kid. I didn't know. Take it for cramps, and it worked, but then I started reading up on the side effects. And even on normal doses, they said the mortality rate can be up to 16,000 people. So really important if we can reduce our risk for ulcers, bleeding, or kidney problems, and there's healthy alternatives like turmeric. Why not? We know magnesium gets used up when we're in a lot of stress, and magnesium is a natural muscle relaxer. So it can actually make a huge difference. We've heard of probably Flexerils or some of the other muscle relaxers, and I'll put that in quote, but they actually don't work directly to relax a muscle. They usually make you drowsy, and the idea is when you're sleeping or asleep, then your muscles will relax more, which can happen. So they can help folks, but again, they can become habit forming and have potential side effects with that. Again, making you drowsy. The magnesium won't do that. And it's a natural mineral in our body, involved in many different reactions, very calming, helps with sleep, and it can relax those muscles, which is nice. It can actually even lower blood pressure. I've seen that too, which is pretty cool. So pancake those hands, rotate around. Good. We're gonna just press in and we're gonna look up as we do that. Look down. Look to your right and then look to your left. Backs of the hands in towards one another. Turn your head to one side and then to the other. Good. Chin down and gaze up. Good. One more time. Gaze down and then gaze up. Good. We're going to circle around. Circle around. Good. Now we did this standing, but you can do this sitting or standing. We're actually going to rotate that palm here and rotate in. And wrap it all around the body. Call this the waiter or server. Palm up the whole time. Good. And let's get to do this one more time and go to the other side. Good. So we're literally just rotating, kind of twisting around with that palm. So palm is up, rotate in, around the body. You can follow the hand with your eyes, get a little eye stretch in here. I'm going to do this a few times at your own pace. Good. If you're like, I'm not getting it, just practice. With anything, it gets easier as we do it. You just want to try to keep the palm up the whole time. One more time. Good. Good. And again, we're going to use that strap. If you don't have a strap, you can just, again, budget. It's okay. Just hold the arms up. Remember, overhead is only if you're able to. If not, your arms are staying halfway. and just gently pulse to the top of your head, down to the back of the neck. This will actually work those shoulders a little bit. And then we're going to just figure 8, and we're going to rotate back. So we want to do heart openers is opening up that chest. Good, and then just gently back. Gently back. Oh, it feels so good. And then see if you can extend the arms all the way back and just reach back. It should feel really good in that side waist and the shoulders too. So we're opening. Good. Countering, sitting and slouching. Opening up, getting a little bit taller, even more taller than you were yesterday. Yes. Is it possible to grow? You bet. Actually had a 78-year-old patient with osteoporosis. She grew a ½ inch. And we were just doing the exercises. We started to strengthen her bones. And remember, that bone wants to have that calcium, the good materials. It's much more than just calcium. It's phosphorus. We need to have magnesium there and make sure there are good amounts of estrogen. So there's a lot of different things there that can help. Vitamin K, K2 especially. If you take vitamin D supplements, you want to add K2. What that K2 does is directs that calcium that vitamin D helps bring in directly into the bone instead of calcifications in the arteries. You don't want calcium deposits in your arteries or your breast tissue. Oh, and it's Breast Cancer Awareness Month. If you check out some posts, to get my thermogram, and if you're not familiar with thermography, it's a camera. There's no squeezing involved of the breasts, which I was very grateful for. And what they do is using images of heat. They check temperature sensitivities. It can actually determine if there's a lot of inflammation in the body or not. So it's not a diagnostic. It's one of the tools to help with a diagnosis, but it doesn't replace mammography, but it can identify things sometimes early on before a mammogram would. And I tend to have pretty dense breasts, which the radiologist told me the mammogram can miss tumors, and they always recommend usually ultrasound after or additional testing after I get my mammograms. So I thought, why not get this to get a little more information? So I got my ultrasound, I got my thermogram, and then I'll see about I had a mammogram not too long ago, but if I need to get another one. It's just radiation. The thermogram has no radiation, so which is great. And if you're local in Tampa, June Brennan is the one I went to see. I have a little interview, or I have her speaking about it, which is pretty neat. Okay, let's do a gentle twist now. So we're going to place our hand on the opposite knee. And again, I want you to find your stretch today. So we're going to just gently turn. My hand is alongside my back. The other hand on the knee and twist. And then switch. Good. I'm going to place our hands behind us. Reach up and gaze up. Big smile. Good. Now you can come to Shavasana now. Final relaxation. Or if you want to stay seated, I think I'm going to lie down. I just feel like it. Listen to your body, right? It's good to relax. Oh, feels so good. So just lie here, let go. Any thoughts that pop into your head, let them fly away, float away. This is quieting that monkey mind. If you have inner chatter, lower the volume. Give yourself permission to be at peace. Your next breath, start to wiggle those fingers and toes. Gently roll to your side, rolling up into a little ball. Take your time, gently come up. And know you matter, you're worthy, you're amazing. Hope these heart openers, chest openers, hip openers helped you today. And thank you for joining me on Inspired Stretch with Dr. Gold. I take requests. Anything that you need, please let me know. I'm here to serve you. And we've been talking about the sugar cravings and kicks, and I just wanted to give one tidbit for helping with sugar cravings. So first part that makes a huge difference is not having it in the home. But we know we tend to crave sugar when our blood sugars start to drop. So having adequate protein throughout the day, especially in the morning. A lot of times people have cereal and milk, which is not very high in protein. Eggs are a better form, and if you can get the pasture-raised eggs, those are good forms of the type of eggs. Because if you think of cage-free, all that means is the cages are open, but if those hens are in huge kind of a factory or in a huge place, enclosure, they may not be able to roam or get out, and a lot of times they do pump them with stuff. Or if you just look at the hen of today versus the hen of the 1950s, there's a huge difference in size. So what they're actually doing, but the idea is if our animals are maltreated and they form a lot of stressful hormones, we're eating what they form. So whatever they're being given, we're getting that into our bodies if we consume them. So really important to pay attention to how the animals are treated. And if you're trying to find that out and not able to get answers, I would be a little cautious. I usually try to buy local where I can actually visit the farm, which is nice. And then you can see how the animal, now obviously I don't want to meet the chicken I'm about to eat or anything, that's tough. But if you can see how the animals are roaming and free and being not fed just grain, if they're able to eat on the pasture, the food that they normally should be eating, that would be a great thing that they would eat in the wild. Let's take another nice deep breath. So where I'm getting back to with the sugar is just putting good nutritious foods in our body. Good protein sources will help to balance out those sugars, and then making sure you're hydrating, asking yourself, am I hungry? Because sometimes when we crave sugar, we just need food. So getting some water and actually having snacks with you, so you're not picking what's in the break room or in the refrigerator. If you just have lots of ice cream in the freezer or candy, and then we did just a few days ago, we actually threw away sugar. Our neighbor in good conscience, she's part of a food co-op, and gave us bags of sugar. We're like, we don't eat this, but anyway, we got rid of it, and just junk food that we just don't eat. So thankfully I felt good. Chocolate cakes and all that stuff, again, don't need it in our body. And Halloween candy, nah. So that Switch Witch, if you're not familiar, she comes to your children's homes and switches that candy for a beautiful toy. I just thought that was so cool. There's a whole story on it if you want to check out the Switch Witch. But, this holiday season, we can give toys to the kids. We can be in happy costumes rather than scary gremlins and vampires and stuff. I know they're cool, but, this year, let's bring in, haven't we had enough doom and gloom? I want to bring in joy and cheerfulness. So spread cheer, not fear, joy with a toy, and better treats, better than sweets. So again, this is Dr. Golds with Dr. Golds Optimal Living Institute. Welcome, and thank you again for joining me on Inspired Stretch. If you leave a comment, I really do appreciate that. And if you can like my page, thank you for that. And anything I can do to serve you, please let me know. Have a beautiful day. Live optimally. Toodles.